Now I can tell you your other nasal features are actually ideal. So the position of your tip is ideal relative to your upper lip, and I think the shape of your tip is ideal as well. So I don't plan to make any significant changes there. Now we talked a little bit about your chin when I was examining you, and I think one of the things that may improve your profile is actually to bring your chin forward a little bit. So if I were to augment your chin and bring it forward a little bit like this, I think that actually improves your profile. It doesn't really even take that much advancement to improve the balance of your face. The other thing I often find is that when we advance the chin a little bit, it often tightens up your neck just a bit too. So you may find that that sort of tucks up a little bit when you have the chin advanced. So this is something that we certainly can do at the time of rhinoplasty. It's a very common ancillary procedure. So often people will have a rhinoplasty and also advance their chin at the same time. They often go very well together. So Courtney, this is the before on the left, and then this is the after on the right. And that's with both the bridge of your nose reduced slightly and your chin advanced slightly. So often a little bit of both can make a really big difference. I think what you can expect is probably something like that. It may be a millimeter in either direction, but I think both, you know, whether it's a millimeter higher or a millimeter lower, I think that's going to look very good.
How exactly is the hump reduction performed?
Well, in your case, what I'm going to do is called a closed rhinoplasty. So I'm going to make some incisions that are actually behind your nasal tip on the inside of your nose. That's going to allow me access to the bridge part of your nose. And I'll be taking down the cartilage part of the bridge with a scalpel and the bony part with a chisel. Now, once the bridge is taken down, the nasal bones on the outside will need to be moved inwards. I'm going to make a very tiny little cut. And again, with the use of a chisel, I'm going to gently tap an incision or a cut into each of the nasal bones and then just gently move them together again. And that's going to allow your bridge to come together in a more narrow fashion the way it is now.
Will I be able to see the incisions that are performed on the outside of the skin?
So the incisions that I make to move the nose bones inwards are a little bit less than 2 millimeters. They're going to heal on their own. They'll look like a scratch for about a week or so, and then you probably won't see them anymore.
Will you have to break my nose?
The nose bones are very thin, and although it might take a significant injury to break them externally, when we cut the nose bones with a very sharp chisel, it's very small and doesn't take a lot of force at all to get them to be mobilized to allow me to move them inwards.
What can I expect from bruising and swelling?
Well, for the rhinoplasty, you're going to have some swelling of the bridge and tip of your nose, but that's going to be covered with a cast. So you'll have a small cast that's placed on top, and you'll need to keep that on for a week. There's going to be some tapes underneath that. You probably will have a little bit of bruising and swelling around the eyes. As I said, it varies from person to person. For the chin, you're going to have some small stitches underneath that you may be able to feel, but they dissolve on their own. And on top of that, you're going to have some compression tape. So you'll have to have a dressing on the chin and a dressing on the nose. You certainly can go out in public. You may not want to, but certainly you can do some light activities like go for a walk or something like that.
What are the risks of these procedures?
So I think the risks can really be categorized as medical or cosmetic risks. And I think with any surgery, medical risks certainly do include bleeding and infection. And I think with the nose, you could potentially have some nasal obstruction after the surgery. That's quite rare, but it can happen. With the cosmetic risks are really related to probably the degree of change that we can achieve. We may want to bring your bridge down enough, so that you see an obvious change. But as you heal, sometimes scar tissue can form that will actually reform some of that bridge that we've taken down, and you may not necessarily get as low a bridge as you might have liked. That varies from person to person, and it's very difficult to predict or to really change. Sometimes it just happens. With the chin, I think we have to be careful not to overdo your chin or underdo your chin, and this is partly why we've had a long discussion using computer imaging to try and make sure we get the right position for your chin and choose the right sized implant.
He went over all the questions I had and answered any extra ones that I came up with during the consultation. He gave me a really detailed description about how the surgery would pan out too, so what he would do to my nose and how he would perform the hump reduction. I really liked the computer imaging. I think it gave me a realistic sense of what I'm going to look like, and it was great to have that visual to see what I was going to look like after the surgery.